Hi guys, welcome back to Mom Talk. Today we are talking about everything upper GI, reflux, spit up in babies, that sort of thing. Last month we talked about lower GI, so we're kind of working our way up. So we see a lot of reflux here, like a lot. And we just want to talk about things that we would normally do to help relieve those symptoms. So, first, chiropractic care, always. The nerves in our upper T-spine or our upper back go to the area that supplies our upper GI system. And so if we have some subluxation there or misalignment, we can have interference to those nerves that go to that area and cause us to have symptoms of reflux or indigestion or upset tummy.
And that can go for adults too, with indigestion, heartburn. We talk about babies a lot with reflux, but same concept with chiropractic care. The nerves that leave the spine and go to our upper digestion, and adults that struggle with indigestion and heartburn. I literally had a patient tell me yesterday, when her heartburn and indigestion started acting up, she knows she needs to get a chiropractic appointment. So with babies and then all the way through adulthood too. Especially, I know it affects pregnant mamas a lot as well. So just every phase of life.
I also see a lot of times when those babies start really pulling their head up, either on tummy time or laying on their back, and start really making those upper T muscles start firing. We see an increase of spitting up too, and that's a great time to bring them in, get checked, and get them adjusted.
And I think for adults too, it's super important because like our gut is our second brain. So a big thing too is like stress. If you are super stressed, it can bring that inflammation, but your body knows. And sometimes we see an increase in those symptoms whenever that stress is present, whatever it is, kind of happening throughout your life too.
And that's what chiropractic can help with that too, helping your body get out of that fight or flight. Unfortunately, we can't put a bubble around you and protect you from your stress. But if your body's not in that constant fight or flight, it can deal with that stress just a little better and not turn into that spitting up acid reflux.
Yeah. On top of that, our diet. Our diet we talk about a lot here. It makes sense with this one, right? Upper GI system, of course, diet. If you're an adult who suffers with indigestion or heartburn, a lot of times we hear like spicy foods or acidic foods. Sure, absolutely. For babies, sometimes we can see that with a dairy allergy or milk protein inability to process that. We can see it with other foods too, eggs. So it's hard sometimes to say like it's only diet, but diet does play a big role in making sure that we're also staying hydrated. Water is a big part of that as well.
Supplement wise, so I always, if anybody is having any kind of reflux, I always talk about papaya enzymes. I literally never have indigestion or reflux unless I'm pregnant. And I lived on papaya enzymes. It literally took it away. So I always recommend, of course, until we get to the root of the problem, that papaya enzymes can help calm it down and let your body not have that reflux.
Yeah. We can use that in children too, can't we? Sometimes.
Yes, a lot of people do chop it up and put it in their bottle, but of course you want them to talk to their pediatrician.
Absolutely.
But there is a lot of people, and if a mom is nursing, she can take it because that can definitely go through the milk. So, but I am a big fan of papaya enzymes for acid reflux.
Mm-hmm. And even simple things like positioning. People talk a lot about positioning and reflux. Elevated tummy time kind of helps with combating like gravity. As gravity pulls down on us, elevated tummy time is really going to help that food feel kind of settle into the stomach. Even in adults with posture, because too, kind of we're all sitting like this. So trying to make sure that like we're good so our bodies can actually like Dr. Chloe said, the gravity go down where it needs to go, too.
And that's a good point. With all the bad posture we're seeing, definitely taking care of your spine, muscular with the exercises, with getting adjusted will definitely help with that. That's a reflex.
Absolutely. Posture's that's a really good point. Awesome. Does anybody else have anything else that we do for acid reflux? I think
Always know that we, I think I did this last night again. We keep these little cards, these little handouts. They're so easy to just kind of grab and take. Just simple reminders for natural protocols we have throughout the office. Last time we talked about the constipation one, but we have a reflux one too. So either we can hand them to you or ask the front desk. And it's just a good thing to keep on hand. It's everything we just talked about. Chiropractic care, tummy time, diet enzymes, and gluten and dairy intake.
awesome. We'll see you guys next month for more mom talk. Let us know if there's anything that you want us to talk about. See y'all soon. Bye.